Hello, friends. Welcome to Creative Medicine. In this lecture, we will learn about
Media used for Staphylococcal aureus. This is for Staphylococcal aureus. For Staph aureus, the culture media used for the Staph aureus are: for Staph aureus, you can use 5% sleep blood agar can be used. In the 5% sheep blood agar, you will see presence of pinpoint colonies are seen with narrow zone of beta hemolysis. Here pinpoint colonies with narrow zone of beta hemolysis are seen. Then on McConkey agar can be done. On McConkey agar, you will see presence of lactose fermenting colonies are seen. Then we have selective media also. In the selective media, the selective media for Staphylococcal aureus are: we have salt milk agar, which contains 8 to 10% of sodium chloride. We have mannitol salt agar with 7.5% of sodium chloride. Ludlam's lithium chloride or tellurite media is present. And here in this selective media, the media for pigment, see, we can use these three media, that is salt milk agar, mannitol salt agar, Ludlam's lithium chloride and tellurite media can be used. But these staphylococcal contains a keratin, beta carotene, and this beta carotene is responsible for the yellowish pigmentation, especially in the nutrient agar. So for the pigmentation, we can use milk agar or glycerol monoacetate agar or queen agar can be used with 22 degrees Celsius incubation. Then golden yellow pigmentation is seen on the nutrient agar due to beta carotene. Due to beta carotene, we see golden yellow pigmentation on the nutrient agar.
thank you and thank you for watching.